Gauteng is quickly catching up to the Western Cape in terms of the number of COVID-19 infections. Gauteng has now recorded over 63,000 positive cases. The debate now is, should stricter lockdown regulations be imposed? Well, eNCA reporter Khayelihle Khumalo this morning is up and about getting the views of political parties, and now he's joining us, and he's with the DA's Gauteng leader, John Moodey. Khaya, good morning, and thank you very much for your time. I mean, we understand already this morning that the Gauteng government has been meeting this past weekend and has come up saying they won't push hard for stricter lockdown regulations.
Well, absolutely, Braden. So there has been a very fierce debate in the country's economic hub, given the very surge of cases in as far as COVID-19 is concerned. So in the meetings that have been held by the Provincial Command Council, the main issue has been, do we go back to the very strict measures in terms of making sure that we flatten the curve, given the fact that we're seeing the numbers really increasing dramatically, but also more importantly, how do you try and change the behavior of the people across the province, especially because it's a highly densely populated area in South Africa. But let's get now the perspective from the Democratic Alliance here in Gauteng. Mr. Moodey joins us now. So, Mr. Moodey, we know that you have been so much opposed to the idea of the lockdown, especially just going there for the second time. But what is your perspective now, given the fact that we're seeing the numbers rising quite dramatically?
Well, it is of huge concern to us as a DA in terms of the numbers that are now increasing in Gauteng. We have become the epicenter, as you correctly indicated, highly populated, highly and densely populated province. And it is indeed something for us to be worried about. But we cannot go back to a lockdown level 4 or 5, quite frankly. What we have to look at is we have to look at how do we enforce the regulations, because the regulations are in place. And also, together with the law enforcement agencies going about doing the enforcement of the bylaws, it has to be supported with an education program. Because ultimately what citizens need to realize is that your safety and your health is your own responsibility in the first instance, and thereafter, of course, the health situation of your family and the danger of COVID infecting your family is your responsibility too. So this has to be something where society also takes responsibility for their actions. If you go down the road from where we are now, 2 kilometers from here is Westbury. Go through Westbury and go through other townships and see. Social distancing, the application of the regulations or the compliance with the regulations is not taking place. It is life as normal. And this is an abnormal situation. Ultimately, the responsibility rests with us as citizens. But here's the thing. When a person looks at the demand side from that our health system is facing, the number of beds available, and having spoken to doctors and people at hospitals, since level 3 has come into play and the sale of alcohol has now been allowed, we have seen our casualties are once more inundated with those social ill health problems, such as stabbings, assaults, accidents, and so on. And those type of illnesses or health problems are taking up much needed beds that very soon will be needed for our COVID patients to be occupying. And that is something that we could perhaps be looking at is, the pros and cons of the ban again on alcohol, or the restriction on the sale of alcohol. And there was even talks about perhaps going back into curfew. Now, we cannot support anything that will continue to have a stranglehold on our economy. But if the curfews can be perhaps done in such a manner that it does not strangle our economy, but at the same time at least assist law enforcement agencies and officers to be able to enforce the lockdown regulations, and that's something we need to look at.
And just in terms of making sure that there is behavioral change among people here in Gauteng, how do we try to make sure that happens? Especially because we've seen today more grades are going back to school, so the economy is reopening. So how do we try and make sure that people do change how they do things?
We have one of the biggest organized community bodies that exist is our religious fraternities. I think our imams, our rabbis, our pastors and priests and things must be speaking to their communities and informing the communities that they need to take responsibility for the pandemic that we are facing. Adherence to regulations in South Africa, unfortunately, something that has always been a challenge. I think cultural change in terms of how we think about compliance, that also needs to take place, because if you look at other countries where there is a culture of compliance, you will find that they've been able to flatten the curve just by human behavior and societal behavior patterns changing. This is a new norm that we are living in, and we're going to have to change our lifestyles. You and I were discussing it earlier on. We're African. We love to socialize. We like to be with our families, our traditions, and those ceremonies that we perform as regularly as we can. Those are things we're going to have to start rethinking, because and even going to funerals and so on. As I've had a good friend, or my personal friend, who died, I couldn't go to his funeral. But that doesn't mean that I don't respect the fact that he's gone on, and that I'm not there to still support his family by means of a phone call. We need to change our behavior, that more than anything else. And it is our personal responsibility to do so.
And maybe just before I let you go, sir, so one of the suggestions, for example, is that we should close the economy for 2 weeks so that we allow for the issue of COVID-19 to be dealt with decisively. Do you think that's a fair suggestion?
No, definitely not. I mean, I think that will be counterproductive. Definitely be counterproductive, because you're going to close the economy for 2 weeks. That is an incubation period of time. People are already infected in their homes and in society. It does not mean that people are going to stay within their homes. Definitely not. You can't want to start and kickstart an economy that really needs to get out of the doldrums, and they want to lock it off again. It just doesn't make sense. People will rather just close down, close shop, and then we will be in even deeper trouble economically, because it's about livelihoods and lives. And I see on a daily basis our people come here already trying to work out a living and just to put food on the table. It is a difficult one, but it's something that we definitely cannot support. The thing is, it comes right back to us as individuals. We are all in it together. It is not just the government responsibility, it is our own personal responsibility as well.
All right, Mr. Moodey, thank you so much indeed, sir, for your time. So that's the Democratic Alliance leader here in Gauteng, really giving us their perspective, saying that they're totally against going back to the lockdown. Perhaps we should explore other measures. We have the toolbox, so we should really make sure that there's proper enforcement of the regulations that we have currently.
Thank you very much, Khayelihle Khumalo. Now, one economy